Hi, Dr. Turowski here. I would like to talk to you a little bit about the rhinoplasty procedure. This is actually the second most common procedure I performed in our clinic here, and would like to give you some information about it. Obviously, we're not going to go through everything, but just to give you an idea what my philosophy about this procedure is and what to expect. First of all, rhinoplasty is a special procedure. It is very visible, so you have to be very careful who does it and where you do it, because this is not the type of a procedure that you can hide, and even if the results are not perfect, you probably will be okay. Here everything has to be perfect, so the surgeon and the clinic has to be selected very carefully. One of the biggest issues with rhinoplasty is how to avoid secondary procedures. So my philosophy is to do everything possible to avoid secondary surgeries, revisions, and I'm glad that I can keep it to the minimal with the experience of thousands of surgeries performed. First, we're starting with a consultation. Obviously, not everybody can come for a consultation immediately to our office. So for those who are from the abroad or from the distance, I offer virtual consultations. You just have to send me your photographs from the different angles, and I will be able to discuss your procedure with you to the extent possible without seeing you in person. But after this type of a consultation, we may have the idea of what can be done, and also give you an estimate on how much it will cost you. So once you decide that this is something that you want to go ahead with, then you can come to our office a day or two before your surgery, discuss the procedure, and at that time I will be able also to perform not only examination of your nose, because one part that cannot be done through the internet or through the Skype is to internal examination of the nose. Nose is not only the shape, we're also talking about the function. So some people right away know that they cannot breathe well through their noses, so obviously they will need to have it fixed together with the changing shape of the nose. However, in some patients they may not have a difficulty breathing through their noses, but with the corrections that we are proposing, their nose may become too narrow or too small for adequate breathing. So after examination, I can tell you if this is something that has to be done together with the reshaping of the nose. It's called a septoplasty, and actually most of the patients that are operated on by myself have both procedures performed, septoplasty and rhinoplasty, and this is to avoid one of the most common complaints after the nose surgery, inability or difficulty breathing through the nose. With this approach, I literally have nobody that has the long-term problems with breathing to the nose. So function is important. Remember that the looks are important, but the function is important. Going back to the looks, something that I cannot perform through the virtual or internet consultation is actually showing you how your nose would look like after surgery. In the office, we have a simulation computer and camera that can actually take 3D pictures of your face and nose, and then I can manipulate the picture, showing you literally what I think can be achieved, and we can communicate better, showing you what can be expected, and if this actually fulfills your wishes to the change of the nose. Sometimes I can do it, sometimes I can't, and better to know that before surgery than after. So definitely this allowed me to communicate better with the patient, so we have a plan of what to expect before surgery and what to expect after surgery results. Obviously, for those who come for a distance, this cannot be performed without you being here in the office, but certainly can be done right before surgery, just to make sure that we are on the same page with the results that are expected. As for the surgery, it is done under general anesthesia. There is no other way to make it safe for yourself and be comfortable for yourself. You wake up with a splint on your nose, and generally the discomfort is quite minimal. You may look not good, you have a splint on your nose and there are some bruising, but this goes away very quickly, and literally in a week later we remove the splint, and for sure in about 2 weeks later you will look presentable. You can go back to your usual activities and work. Obviously, the healing of the nose is not immediate. However, right from the beginning, you should look better than before surgery. Final result may be expected in a year, but that doesn't mean that you really have to wait for a year to look good. And for most patients, within a couple weeks after surgery, they look already very good and definitely can be attending weddings and taking pictures about a month after surgery. So obviously the plans can be individualized for different patients. Please visit our before and after gallery. We have hundreds of pictures of our or my patients, and you can see that what actually can be achieved. And sometimes these are small differences, sometimes these are dramatic differences, life-changing different surgeries, but we take care of all of them. I have sometimes patients that request very small differences to just the tip surgery or just the nose crookedness correction. Obviously, we are all exposed to Instagram and Facebook every day now, so these small changes can actually decrease your anxieties and make you feel better about yourself. And that's the goal. So again, please contact us either through the internet or through the telephones and come for a consultation. And I'd be happy to discuss your nose surgery with you.